Deciding on an abdominoplasty or a tummy tuck can be a difficult decision. There are many reasons why someone may want to have a tummy tuck. This may be because after having children, there's excess skin, and no matter what you do, you just can't get rid of that extra fat. Other people may have had significant weight loss and works very hard to reach their target weight, and unfortunately, this has left them with some skin and tissue in the lower part of the abdomen. Sometimes the reason for wanting a tummy tuck may not be due to excess skin or soft tissue. It may be because of the shape of the abdomen and there are weaknesses in the muscles. After your consultation, I will decide which aspect of your abdomen requires addressing before we commit to any type of surgery. Whatever need you may have for surgery, there are some key aspects that help improve the surgical outcome. It's incredibly important to maintain a healthy weight prior to your surgery for both surgical outcomes in terms of reducing complications, anesthetic outcomes, and cosmetic outcomes. A discussion will be made about a target weight that you will need to reach prior to your surgery, and that target weight will need to be held for 2 months before the surgery and maintained after. Exercise is very important to help strengthen the muscles, to give you a better outcome and the more defined look. Stop smoking. Smoking increases the risk of infection and wound breakdown and also the recovery period. Therefore, I advise people to stop smoking at least 2 months before the surgery and not smoke at least 2 months after. Long haul flights. Long haul flights increase the risk of clot formation in the leg, and we advise you not to go any long haul flights at least 6 to 8 weeks before surgery and 6 to 8 weeks after. Once we have decided on the surgical procedure and you have reached all your goals and targets, you will need to be aware of the post operative recovery. When you wake up, you will have a soft corset with a thick cotton padding between the corset and your skin. This will help provide support and help with the swelling after the surgery. You will be bent over at the waist, and over a 2 week period, you will slowly straighten up. There will be some stinging and pain in the middle aspect of your tummy going underneath the breast, which lasts for a few weeks. You would be advised not to do any heavy lifting and bending over during the 2 to 3 week period after surgery. If you do need to bend down, this will need to be done at the knees, maintaining the bend at the waist. If you need to cough, we will advise you to use a rolled up towel against your tummy and push against this before you cough. We will also give you injections to help you maintain the blood staying thin. This will need to be injected once a day in the evening. I will advise you to wiggle your toes and potentially walk around the bed every hour to help improve the circulation and prevent complications such as clots. Everything needs to be kept dry and the dressings need to be kept intact. You'll be seen in dressings clinic after 1 week where the corset dressings is taken down. The dressings will be changed and the soft corset will be reapplied. Continue with the instructions as with week 1 and we will review you in the second week. At 2 weeks, we will remove the soft corset and the dressings. Provided everything is healing, we will exchange this to a harder corset, which will further help shape the waist and help with the swelling. This needs to be worn day and night for the first 5 days before it's worn only in the daytime. It can be uncomfortable, but bear in mind it does help. The recovery period after an abdominoplasty is approximately 6 weeks. I would advise you to take 3 weeks off work, particularly if you have an active job. Although you'll be healed at 6 weeks if all goes well, internally things are still changing and the swelling is still present. For these improvements to continue and be complete, it can take up to 9 months, maybe longer, for things to settle down and you will feel better. At 6 weeks, although you may look well and feel well, you will need to have breaks and you will feel tired if you do any strenuous activity. As with every procedure, there are risks. Bleeding. Bleeding may require you to go back to theatre. During this process, the bleeding or the clot will be washed out and everything will be closed up again. I will make a decision whether I put in a drain. Infection. This can develop any time after the surgery until healed. Treatment includes antibiotics or additional surgery may be necessary. Pain and stiffness. This can be due to the surgery, and in some cases, it can be due to the position after the surgery. The surgery may also exacerbate pre existing back pain, and chronic pain can sometimes occur with nerves becoming trapped in the scar tissue. Seroma or fluid filled cavities. The body naturally absorbs fluid. However, if this accumulates, it can become problematic and we may need to drain it. Change in sensation. This may be diminished or loss of skin sensation temporarily or permanent. Some patients may feel a tight girdle sensation and bloating. There may also be some shooting and pulling pains which can last for a few months. Delayed healing and wound dehiscence. Some areas may take longer than 2 weeks to heal and require additional dressings. There may also be wound breakdown. Smokers and diabetic patients are at higher risk of this. Scarring. On the surface, the scar will be around the level of the knicker line. The length will be determined by how much we remove, and there will also be a scar around the belly button. Abnormal scars may occur within the skin and deeper tissues, and these may feel lumpy and appear stretched. Additional treatment may be needed to help these. Skin contour irregularities and asymmetry. These are as expected. Contour irregularities and depressions may occur, and there will always be a degree of asymmetry. Residual skin or irregularities at the ends of the incisions or dog ears are always a possibility. This may be improved with surgical correction or may go away on their own. Sutures. You may notice sutures or stitches after your surgery. These are dissolvable, but some of them can spontaneously poke through the skin. They can become visible and cause irritation, which either fall out or may require removal. Asymmetry and change in body shape. Factors such as skin tone, fatty deposits, bony prominence, and muscle tone may contribute to normal asymmetry in the body features. Umbilicus. Malposition, scarring, or unacceptable appearance or loss of umbilicus or your belly button may occur. Intimate relations after your surgery. We advise you to refrain from any intimate relations for approximately 3 weeks after surgery. Unsatisfactory results. You may be disappointed if the results of the abdominoplasty does not meet your expectations. It is imperative you have an open discussion with me prior to your surgery. If there are complications or unpredictable scar settlement, there is no guarantee that the results that we wanted may be obtained. Long-term effects. Subsequent alterations in body contour may occur as a result of aging, weight loss or gain, pregnancy, or circumstances not related to the abdominoplasty. We plan to minimize your risks as much as possible. However, sometimes people do get complications regardless. It's important to be prepared for all eventualities and be aware of the signs. Good luck with making your decision, and if you've already made your decision, I hope to see you soon.